Your baby was finally sleeping through the night. Then, out of nowhere, they're up every hour like a newborn again. You're Googling at 3 a.m. Why won't my 4-month-old sleep? Here's the thing most parents don't realize. This isn't a regression. It's actually a progression. Your baby's brain just leveled up. But here's the problem. Nobody told you how to handle it. In the next 10 minutes, I'm going to explain exactly what's happening in your baby's brain and give you a gentle, science-backed plan to get through this without losing your mind. Let's dive in. Section 1, what's actually happening? First, let's talk about what the 4-month sleep regression actually is. Around 3 to 5 months, your baby's sleep architecture permanently changes. This is why I recommended sleep training at 4 months for your own sanity. Let me explain why. Up until now, your baby had 2 sleep stages: light sleep and deep sleep. Simple, but around month 4, their brain matures and develops adult-like sleep cycles with 4 distinct stages. They now cycle between light and deep sleep every 45 to 60 minutes, instead of staying in deep sleep for long stretches. And every time they transition between cycles, they partially wake up. Think about it like this. You wake up slightly between sleep cycles too. You might roll over, adjust your pillow, or check the time. But you've learned to fall back asleep on your own. But your baby hasn't learned that skill yet. If they've been rocked to sleep, nursed to sleep, or held to sleep every single time, they don't know how to fall back asleep independently. So when they hit that partial wake-up, they need you to recreate the exact conditions they had when they first fell asleep. This was me with my firstborn. I was awake every hour soothing him back to sleep. This isn't a regression. It's a permanent shift in how your baby sleeps. And the good news, this is actually the perfect time to teach them independent sleep skills. Section 2, signs you're in the regression. How do you know if this is the 4-month regression and not something else? Here are the telltale signs. Your baby was sleeping well, then suddenly isn't. They're waking everyone to 2 hours at night. Naps are suddenly short, 30 to 45 minutes max. They're fussier than usual during the day. They seem hungry all the time. But here's what this isn't. It's not teething. It's not a wonder week. It's not a phase that will pass on its own. This is your baby's new normal. Their sleep has matured, and now you need to help them learn to navigate it. Section 3, the foundations. Before you start any sleep training, you need to get 3 foundational things right. If you skip these, nothing else will work. Foundation 1, age-appropriate wake windows. At 4 months, your baby should be awake for about 1.5 to 2 hours between naps. If they're awake too long, they get overtired and produce cortisol, which makes it harder to stay asleep. If they're not awake long enough, they're not tired enough. Watch for sleepy cues, rubbing eyes, yawning, or staring off into space. When you see these, you have about a 10-minute window to get them down before they cross into overtired territory. Foundation 2, a consistent bedtime routine. Your baby's brain needs predictability. Create a 20 to 30-minute routine that happens the same way, every night in the same order. Bath, pajamas, feeding, but not to sleep. Then a book or song. And into the crib drowsy but awake. The last step should happen in the room where they sleep, with the lights dim. Here is the key. Laying them down drowsy but not asleep because they need to know that they are going to sleep in this crib. It's trust building between you and your baby and their sleep environment. Imagine you fall asleep in your bed and wake up in the backyard of your house. It's how they feel when they fall asleep in your arm and realize they are in a different environment. So, parents, don't be sneaky. Without that sense of security, it will be harder to teach them to soothe and sleep. Foundation 3, optimal sleep environment. Your baby's room should be dark, cool, between 68 to 72 degrees, and have white noise. White noise is especially important because it masks those partial wake-ups and helps them transition between sleep cycles without fully waking. Section 4, gentle sleep training methods. let's talk about how to actually teach your baby to fall asleep independently. I'm going to give you 3 gentle methods. Method 1, the fading method. This is the slowest but gentlest approach. Week 1, sit in a chair next to the crib until they fall asleep. You can touch them, shush them, pat them. Week 2, move the chair halfway to the door. Less touching, more verbal reassurance. Week 3, move to the doorway. But here's the key. You're not leaving them to cry. You're just slowly teaching them that you're nearby, but they can do this on their own. You will be amazed. After the first night in their own crib, they will start to learn that this is a safe space, and they will start to feel secure in their own sleep environment. Method 2, the check-in method. This is also called the Ferber method, but done gently. You put your baby down awake and leave the room. If they cry, you check in at increasing intervals. Night 1, check in after 3 minutes, then 5 minutes, then 10 minutes. Night 2, check in after 5 minutes, then 10 minutes, then 15 minutes. Night 3 and after, gradually increase intervals. But here's what a check-in looks like. You go in, keep the lights off, use a calm voice, maybe pat their belly for 30 seconds, then leave. If their crying is not improved after a long period, it's fine to pick them up too and help calm them down. Once they settled, be firm. Tell them it's time to sleep. The goal isn't to stop the crying immediately. It's to teach them they're safe and you'll come back. But they need to practice falling asleep on their own. Method 3, the pick-up, put-down method. This method is more hands-on but can take longer. When your baby cries, pick them up and soothe them until they're calm, but not asleep. Then put them back down. Repeat this as many times as needed. Some nights, this might be 20+ times. It's exhausting, but it works for parents who can't handle hearing their baby cry without intervening. Which method should you choose? Pick the method that feels right, commit for at least 1 week, and trust the process. With my firstborn, I was unsure about the process. I have seen many articles stating infants are inability to soothe themselves. But the hourly waking moments to nurse him and the constant upper gas and lower gas problems due to hourly nursing was too much. For our own sanity and my baby's development, we trust the process. And now we can say infants can soothe themselves. They just need to learn that they are safe in their sleeping environment, and you will always be there when they need you. Section 5, what to expect. Let's talk about what actually happens when you start sleep training. Nights 1 through 3 is the protest. Your baby is going to protest. They might cry for 20 to 45 minutes the first night. They're not in pain. They're frustrated because the rules changed. But here's what's happening in their brain. They're learning a new skill. Just like learning to roll over or sit up, it takes practice and it's frustrating at first. By night 4 or 5, you'll notice the crying decreases. By week 2, most babies are falling asleep within 5 to 10 minutes with minimal fussing. If your baby is crying for over an hour, check the foundations. Are wake windows right? Is the room dark? What about night feedings? At 4 months, most babies still need 1 to 2 night feeds. That's fine. Feed them, put them back down awake. You're teaching independent sleep, not eliminating all night wakings. They were doing great, now they're waking up again. Sleep regressions happen at 6 months, 8 months, 12 months, 18 months. Go back to basics. Don't reintroduce old sleep crutches. Expect some bumps in the road, but if you stay consistent, your baby will learn this skill. Let's recap. 1. The 4-month regression is actually a permanent brain development milestone. 2. Get the foundations right. Wake windows, bedtime routine, sleep environment. 3. Choose a gentle method that fits your family and stick with it. 4. Expect 1 to 2 weeks of adjustment, then improvement. 5. Stay consistent through future regressions. Sleep training is hard. You're going to doubt yourself, but teaching your baby to sleep independently is one of the greatest gifts you can give them. Better sleep means better brain development and a healthier, happier baby. And it means you get to be a better parent because you're not running on empty. For all the moms out there, the first night is a great time for dads or another relative to step in. I know I was not able to handle the crying. It's short-term pain and long-term gain. It was our motto to survive the first night of sleep training. Just a reminder, the following information is for educational purposes. I am not a doctor or a medical professional. Please consult your pediatrician about any medical concerns or before starting a new sleep or feeding regimen. Thanks for watching. You've got this.